Hi, Queenly. How are you? Oh, you're muted. I'm gonna unmute you.
I'm on mute now.
Yes, you're unmuted, I think now.
Excellent.
Okay, I'm just gonna, we'll take a couple minutes and I'll just admit people. I think I set it up, so I have to admit people. So
The waiting room? That's a good call.
Oh, I'm so out of breath. I just ran downstairs so fast.
Long day.
Pardon?
Long day.
Yeah, yeah, but a good day, definitely.
You generally would have long days.
Yeah, but it's all good. Just all good. Hi Jen, how are you? When we do the yoga part, you can feel free if you feel comfortable to turn your video on, and then Queenly can like give you adjustments and stuff, but you don't have to. There's no pressure at all.
Okay, thanks.
We'll get started in a couple of minutes, and we just give people like 2 more minutes to roll in. All right. I wonder if I screen share, can I still admit people? I'm just gonna try this really quick. I think I can. Amazing. Okay, so Queenly, why don't we might as well get started, and then I will just keep an eye on things. And if I minimize the presentation, it's only because I can't figure out how to let people in with it up.
Okay, I have it up on the side, so.
Great. Okay. So Queenly and I are super excited to be here today. So we're going to go over acupressure and yoga for relaxation and tension release. So my name is Dr. Ashlyn Lanigan. I'm a naturopathic doctor. I'm also the founder and owner of Flourish Health Clinic. And my passion is really helping women to feel amazing. And so that is my whole idea behind starting Flourish. And what I'm really excited about with Flourish is the team that I have. And so I have this amazing team of women's health experts, and one of them is here with us tonight, Queenly Lee, who is our acupuncturist, traditional Chinese medicine practitioner, and as well she is our yoga instructor and Pilates instructor at Flourish. So we're super excited to have her. So I'll let Queenly tell you a little bit about herself. So you go ahead, Queenly, whenever you're ready.
Hi, everyone. I hope you can hear me. If I cut in and out, please unmute your mic and then just let us know. So yes, Ashlyn and I have known each other for a little bit. We've worked together for a little bit. And I'm excited to be working with her because I get to learn a lot about integration of Western and Chinese medicine. So I'm excited to be working at Flourish as well. And in terms of about me, for a big chunk of time, I was just thinking this year would be my 10th year teaching yoga. And that's big for me. That's 10 years of commitment to something.
That's huge.
That's
amazing.
Really helpful.
I didn't know that.
I know. A full decade. Yes. Maybe a big yoga party later when we can gather in real person. And then later on, I added other modalities like Pilates and TRX just to diversify.
Oh, Queenly? Cutting out a little bit. Can anyone, Jen, can you hear me?
And a licensed traditional Chinese medicine practitioner.
I can hear you.
Sorry, Queenly, you cut out there a little bit.
Okay, so I'll repeat. You're just making me practice repeating my title. That's good. It's good practice. So I'm a licensed traditional Chinese medicine practitioner and acupuncturist, along with my yoga certification. So what we are actually here to do today is to actually combine one core principle that both Chinese medicine and yoga work on, which is to promote circulation. That word flow, like it's a buzzword, but it actually means a lot in medicine, in nature, and everything. And we want always a smooth and free flow of energy, essentially, within our body and our mind and our emotions. So hence the acupressure and the yoga to help us, one, find relaxation, and also two, to release pressure, which I'm sure we all have. We feel it maybe in the chest, maybe in the body, maybe both, maybe in the head, all of the above. So that's what we're up to do today.
And I forgot, I didn't mention this, probably because I'm frazzled and just like ran down the stairs before this presentation, but yeah, Queenly has taught yoga at the Totem, which is the clinic that I also work at for, I feel like, a million years. And so we've known each other for a really long time. And then when she became an acupuncturist, I started referring my patients to her because then they could use their acupuncture benefits as well as their naturopathic benefits. And Queenly is amazing. She actually, I have a patient who was trying for years and years to get pregnant, and Queenly went and did her on-site IVF acupuncture, and that was the only acupuncture I've never done for this patient, and that was the one time she got pregnant. So Queenly is an amazing acupuncturist. So yeah, what we're going to go over today is Queenly's going to quickly talk a bit about the theory behind acupuncture and yoga and what ties them together. We're going to talk about what you can use for your acupressure tools at home. She's going to go over some specific points to help you to relax and restore. Then we're going to do about half an hour of yoga. We'll leave some time for questions, but if you have any questions at any point, feel free to either unmute yourself or just write it in the chat. And then we have a couple bonuses for people attending live. I know we had a lot of people sign up, so a lot of people will watch this later, which is great. But for the few people that are attending live, you guys are lucky. So what we're gonna do is at the end of the yoga class, where Queenly's gonna ask a question. It's not gonna be crazy hard question, but something about the content in our presentation. And whoever's the first to answer will get a free or a pro bono one-on-one yoga session with Queenly. And because of COVID and everything else that's going on, it'll be virtual, but it's a $90 value, so it's super awesome. Also, you'll get some other bonuses for being here. That's our big one. But you can book a discovery call with Queenly. So if you're wondering about whether acupuncture or yoga or Pilates is something that might be a good fit for you, you can schedule a free 15-minute virtual call with Queenly. So I'll send a link for that afterwards. We'll send out the recording of the webinar. So if you want to redo the yoga or remind yourself about the points later, you can do that too. And I'll also send a link to join our private Flourish Females Facebook group. So this is a Facebook group where I'll put all the recordings of the webinars, but also all of the women's health experts at Flourish are all part of the group. So if you have a specific question, you can always ask it in the group or about anything related to women's health. I'm trying to create sort of a community of women through that group. So I'll send a link for that as well too. All right, so Queenly's gonna take it away.
Okay, so I'm first going to actually ask any of you, and please do unmute your mic and speak up, if you are pregnant or if you have any injuries that you may be working with, or like a particular body spot that you're feeling a lot of tension or pain in. That way I know who you are, and then maybe we can focus on those body areas a bit more. So
if you don't want to talk, you can write in the chat too. I'll keep an eye on the chat. Yeah.
Hi, it's Jen. I'm not pregnant. Hi, but I do get tension in my hips and hamstrings.
Okay.
So,
probably from a lot of sitting.
yes.
I'm guessing in the back, like your butt, or the front where the hip flexors are.
Like both.
Okay. All right. So back body, but also the front. Okay. Anybody else? Don't be shy, but you don't have to speak up. We can keep carrying on with the session here. So
you just go ahead, and if anyone has any restrictions, just put them in the chat and we'll adjust. All
right. So there are two things I want you to think about throughout this whole webinar. One is how much stress or tension are you feeling this week? If you had to rate it out of 10, from 1 to 10, think about it. Again, you don't have to verbalize it. Think about it. And then do we, or maybe you, or maybe us all, do we have an inclination to become addicted to stress? This is a concept that I like a lot, just because I think we are all somewhat addicted to stress and we don't want to admit it, but we are, because our society kind of pushes us to be like productive, and we're always valued based on our output. So with being busy all the time, and we always kind of wear that busyness as a badge of honor, like, oh, I'm just so busy lately, or all of the time, then that comes with stress generally. So think about that. I would say I am under the category of being addicted to stress. Not a great thing, but I'm pretty good at helping people release tension and stress. It's a paradox. But I guess you have to understand it to know how to fix it. So the other thing is think about what relaxation is to you, and then do you want more of it in your life? Probably if you're watching this or if you're here live, clearly you're interested. So, all right, let's see the function of acupressure and yoga, specifically for today. So acupressure stems from traditional Chinese medicine, and it's a modality that we use in tuina massage. Tuina translates to push and pull. So it's a type of massage where we go directly onto acupuncture points in the body with pressure, not with needles. And we kind of stimulate those points along with the entire channel that that point is associated with. And the function of acupressure is to promote flow, just like before is a buzzword. But the thing is to promote flow. And what are we promoting flow of? It's qi. And qi is, again, a word that comes from Chinese. But think about your breath or your internal energy, or kind of that aura, your energy around you. I often relate qi to these types of entities. So more ethereal, airy, light, air quality. So acupressure, we use acupressure to promote the circulation of qi, blood, and body fluid throughout the entire body. And flow is important in nature. Think about rain. If the drains are clogged, what happens? Or even if a river is clogged, what would happen? Flooding. Or if there's not enough flow of water, then there would be maybe drought. So similarly in the body, flow is very, very important. So if you also think about water in nature, that helps to bring nutrients to the flora and fauna, so to the forests, to the animals, and a healthy flow of qi kind of helps to sustain kind of normal atmospheric function, which we also need, because if there is an abundance or stagnation of either qi or airflow or water, then we get storm. Not so great. So now in the body, how the qi helps the body. So we want smooth flow of qi and body fluid and blood, because if there is, for example, anything that's stuck in the body, we can feel discomfort. We can feel pain or swelling if there's an excess of body fluid or blood stagnated in a body part, kind of like our hips, probably pretty stagnated. And then if there is a deficiency, then we'll feel achy, or energy will be low, or we'll have difficulty sleeping. So that's kind of the theory behind the acupressure and the yoga. And well, no, that's the acupressure. And then yoga, similarly, we want to promote that flow as well. So flow of qi, we use breath work, right? Inhale, exhale, that's all qi, that's all energy. And one thing that we know in Chinese medicine is one of the theories, and it sounds it sounds a little, again, ethereal. So qi's function is to help move blood in the body. So when we breathe, we actually help promote circulation of blood throughout the entire body. So that's one of the many reasons why breathing and having proper breathing function, or promoting good breathing patterns is so important for us, is because it promotes good circulation throughout the entire body. And also outside of breath work, we move. So the yoga poses and salutations, or any sequences of yoga poses, we then actively move the body to promote circulation, which is what we'll do a little later. So in terms of the tools that we'll be using together today, I have two. One is specifically a golden tool that my friend gave me that I kind of use. It's like a rounded ball, metal ball, that I kind of put against acupressure points and I press on it to stimulate the point. If you don't have such a thing, you can use a pen. So this pen also is kind of like metal at the top. It's kind of round and ball-like, and it's also good for getting into a specific point and helping to release pressure. So a Sharpie, if you don't have either of these things, that would be a good one too. And then also a ball. So for any of you right now live, take one moment to grab tools that are similar to these, be it a pen or a Sharpie or a ball, like a massage ball, like AccuBall or lacrosse ball, and we'll use that together to help us release some pressure. It could be a lip gloss, it could be a crystal kind of rod that's rounded off at the edges that you can press into your pressure points. So take your time, take a little bit of time to get into to get your tools. So now, if you don't have any of the tools, your hands will work too. I mean, best of all is that you have somebody else doing this for you, like a therapist or a partner or a friend who's nice, or if you have children, you can ask them to help you release certain acupressure points as well. So now we're gonna get into it. So first, body areas, the head and the face. You know how, I don't know if you can all relate, but when somebody kind of gently puts their hands on the head, even now when I do this myself, I'm immediately a little bit more relaxed. There's something about like this tingly sensation of having hands softly touching the scalp. So what we're going to do first, without any tools, is just to place your hands gently on your scalp and then gently move your fingertips around. You don't have to you don't have to do motions like hair washing, but go to one spot and then circulate your hands a little and then go to a different area. I generally like the back a little bit more. Try a few different spots. So go sideways, down toward the neck. And there's fascia. Connective tissue is what fascia is all throughout the body. And sometimes when we're really stressed out, the connective tissues on the scalp could be a little tight. So this helps. Now there is a set of points related to the gallbladder channel on the sides, kind of about half an inch to an inch above the ear. So you can place your fingers there and kind of gently rub the sides of the head, gently releasing any pressure that may have accumulated from today or this week. And then now we'll go toward the temples. I'm gonna take my hair back. So temples are right here. You can maybe just use two fingers, like your index and middle finger is good. That indentation at the sides of the forehead. So gently massage, and you can go slow. Always be gentle with the face, even gentler than with your scalp. Go forward, maybe back. Maybe just want to focus with just one finger on the temples. You can do that. And now we're going to slide the hands a little further down. So this point here, the temples, is called the taiyang. And then here, kind of right in front of the middle of the ear, where your jaw joint is, that's stomach 7. Massage there. Many of us are tight there. You may have heard of something called TMJ where your jaw joint and the muscles around the joint is too tight, and it causes your bite to become really close, or it may cause you to grind your teeth at night. Hopefully that's none of you, but it's common when the mind and the body is stressed out, the jaw joint will become tight. So we've gone through a few pressure points here. Now we'll go toward the back of the neck, and we'll actually grab the tools now. So we won't just use the hands. I'll go sideways again. I'm going to use the little ball on my little tool. It's supposed to be a scoop for moisturizer, but moisturizers belong on my finger and my face, not on a tool. So I'm using it for acupressure. So on the back of the neck, there are 2 points at the very base of the skull at the top of the neck. So if you kind of slide your fingers up on one side and the other, there are 2 indentations at the base of the skull. They're pretty prominent. It's called gallbladder 20. Now, you can grab your tool and kind of just circulate the tool around in that point. And another thing you can do is to keep your tool, or if you don't have a tool, you can use your finger. A thumb fits in there pretty well. You can keep your finger or your tool pretty stable, and then just kind of move your head from side to side or up and down, so that you're getting a bit of movement and release in that pressure point. This part of the body is tight on most of us. Let's say, yeah, at least 90% of us in our society, in this city, just because we've been sitting a lot and the neck tends to get tight when we don't get enough sleep. So you can do both sides because there are 2 points at the back of the neck. Don't neglect the other side. So again, you can move your physical body while keeping your tool or your finger stable at one point, or you can move the tool around. See what you like more. So that helps to release the muscles on the neck. And then now, I'd say we'll put the tool down for now, and then we'll go toward the sides and the front of the neck where the scalenes are. So the sides is the medial scalenes. You can use 3 fingers maybe on each side and kind of pressing muscles in toward the bones. You can be gentle with yourself. You don't have to go too hard. Maybe opposite hand to opposite side of the neck.
What is it with dogs and yoga mats? Like, he has 2 beds in this room, and he's like, your yoga mat is out.
They love, pets love yoga mats. While I was doing, like the whole time I've been doing virtual yoga classes, I see dogs coming to kind of just get into the space. Yeah. They love yoga mats, and they love it when their humans are on the floor, I think. So now the scalenes, not a place that we really get into very much. Stomach 12 is a point that's right at the middle of the collarbone. We're gonna go around that point. So you can use your fingers, hopefully you don't have long nails, and kind of just press in and dig your fingers down a little bit. You can move your fingers like left to right while you dig down and get into the scalenes. It's a strange feeling, but these muscles, the anterior scalenes, get really tight when we start to breathe more shallowly. You can do both sides at one time, or again, you can do opposite hand to opposite sides of the neck. So when we don't breathe down toward the diaphragm and we're taking shallow breaths, these muscles, the scalenes, work extra hard to lift the rib cage for the inhales. So they get tight when we don't breathe properly. And hence, we want to learn to breathe well. Breathe deeply whenever we can remember to. So many reasons to work on our breath. Okay, now we'll move on toward the front of the shoulders. So this is a Chinese name for the point called Jian Tian. It's kind of, if you go to the tip of the shoulder and slide your finger down toward your chest, kind of right here, there's an indentation there. And we're just working with that general area. I actually call this kind of like plucking a guitar, because I generally like to take my thumb in the area in circles first, but then I kind of rub outward, and you'll feel the muscles in the anterior deltoids at the front of the shoulder and tendons there. It's a nice feeling. Send sensations down toward the forearms. So circles or rubbing sideways, up to you. This is a good one to do for all of us because we tend to round our shoulders forward a lot. So these muscles become shorter and they also become weak and tight. So it's good to rub them out and help them stretch out a little bit manually with acupressure. Try the other side. So again, is that indentation part right here. If you go from the shoulder in toward your chest, there's an indentation in that area. And this is the area that we want to rub on. So either thumb in a circle, or you can go outward, up to you. Make sure you're breathing this whole time. Sometimes when we're really focusing on doing something, we immediately forget to breathe. I say we, maybe it's just me. Hopefully I'm not the only one.
Not just
but,
you.
This is something, something we can all think about. It's like, how often do we stop our breathing? Okay, so that's the face and the head, neck and shoulders. Now we go into a set of points that's more for the internals. So we had a big heat wave. Today is not nearly as hot, but a big one for anybody who's pregnant, who is often very hot, or just when you feel that your tendency is to be hot, or your face is red, or you sweat easily, then there's a point kind of on the elbow joint. So if you take your elbow, one of them in front of you, and you'll see the end of the crease, of the elbow crease, that's where that point is. This is a good time where you can dig in with your tool. You can use your Sharpie or your pen with that rounded ball part, or if you don't want to use a tool, you can try with your thumb and make circular motion in that point. So this is a point that is used for releasing excess internal heat. You can try both sides. So bending the elbow at the end of the crease, that's where the point is. You can go in with your tool, again with your Sharpie, or maybe you have a fancy cap to your lips. Hi, dog.
This is Jack. Say hi, Jack.
I like it.
Blocking my camera.
Okay, let's move on to the next one. So this point is useful for all of us. It's for calming the mind. It's on the wrist joint. Also, it's a really, really effective point for dealing with nausea, be it nausea from digestive issues or from pregnancy. So if you take 3 fingers, your ring, middle, and index finger, put them together, and then you look at your wrist crease. You place those 3 fingers from the wrist crease, or like right on the wrist crease, where the other end of the 3 fingers away from the wrist crease is where the point is, and it's in between the 2 tendons of your forearm. So there's again an indentation between the 2 tendons, and about 3 fingers distance away from the wrist crease is where the point is. You can go in with the tool and make circular motions again. This is for calming the mind and for helping with nausea, managing nausea.
This is a great point for nausea and vomiting of pregnancy. I know Queen Lee already said it, but this point is amazing. And you can get your acupuncture to leave little like on, and you can press
Try the other side.
So good.
It's effective.
Super.
I mean, acupuncture overall, pretty effective, I would say.
I would agree. We might be biased, but very.
We might be a little biased, but you know, the good things gets passed down through the eons. And I'm definitely biased because, like, you think of yoga and Chinese medicine, like, it's been passed down for a reason, not for ineffectiveness, for sure. Okay, so on the other side of the hand, of your wrist. So this is the inside of the wrist. If you go toward the top of the wrist, so this side, same thing. Where the wrist crease is, 3 fingers away, and again, it's kind of right in the middle, in between your 2 bones. Just on the other side of PC6, that point for calming the mind and nausea. This one is triple energizer 5. This one is good for, maybe put your forearm down on your table or on your thigh and press down with your tool. This one is good for boosting the immune function. So anytime you may have caught a bacteria, maybe like a cold virus, not the dirty word that we're all trying to avoid, pressing on this point helps the body release the pathogens away from the body. So you can try the other side too. It's 3 fingers distance away from the wrist joints at the top of the wrist, in between the 2 bones. So that's 1. I think I might skip lung 7 just for time's sake. So the next one is a very, very good one. We'll probably need to switch body positions for the next one, for the next 2 actually. Stomach 36, remember this one. Stomach 36 is everything. It's good for so many things. So it's on the lower leg, so you can stand up. And I'm going to prop my leg on my chair. If you have a couch you want to prop yourself on, you can do that. So I'm taking my pants up because, you know, don't have to be that ladylike. So from, there are 2 eyes on your knees, and if you just gently glide your fingertip down about 3 inches, you'll feel this gentle indentation on the outer side of the calf muscle. Hopefully you can see me. So from the outer eye, lateral eye of your knee joint, slide your finger down about 3 inches. You'll feel a very definite indentation. That's stomach 36. Now, dig in with your tool. Dig in with a Sharpie, just because it's your leg. It's gonna take some work for your fingers for you to feel this one, so it's probably much better with a tool. Stomach 36 helps to balance your digestion. It helps to strengthen the entire body, like all of your internal organs, but mostly to really balance your digestion and to improve your gut health, which is very important. It's also a point for supporting your overall physical vitality. So that's stomach 36. It has a lot more functions, but just remember, this is like the everything point. And it kind of helps release the shin muscles a little bit, which tends to get tight. If you want to try the same thing on the other side, you can go for it. Or if you want to move on, we can get into the foot. It's going to be a little hard to show you my foot. Okay, so imagine this with me. So go to your foot. In between your big and the second toe, same thing. From the web between your big toe and the second toe, from the web, just kind of slide your finger lightly up the foot, about roughly 1 inch away from the web. You'll feel an indentation, and that's liver 3. And this one is really good for helping to calm the mind. And the function of this point is also to promote smooth flow of qi throughout the entire body. So throughout all of your organs, your heart, your spleen, your stomach, your liver, your kidneys, your gallbladder, your bladder. So this is a big one. It's a big point. We're doing a lot of important points. So you can try locating it on the other side. So between the big and the second toe from the web, slide your finger gently about 1 inch toward the ankle, and you'll feel an indentation. That's where the point is. And a lot of acupuncture points actually are found based on indentations in the body. It's really neat. So you can try both sides. And so that's the feet. And that is actually all we'll do with acupressure with the tool and with the fingers. So we're going from here, we're going to switch body positions. And we're actually going to do some rolling. So hopefully you have a ball you can use, any type of a ball that's small and has some give to it, like that's firm. We don't want anything soft like a ping pong ball, because that probably wouldn't work so well. But something that is a ball that's firm. And we're going to get into the hips for Jen. So the butt. Go near maybe a wall is what I would recommend. I'm gonna go toward my wall. So I'm literally, my tension often is here in the glute med. There are acupuncture points there in the bladder channel. You don't really need to know them, but what you do is you kind of place the ball on the wall and then your body part on the ball, and then you move yourself from side to side. So you're stimulating the points along the back of the hip joint. This is the glute medius. And so you also help to...
Can you do it on the floor?
On the floor? Yeah, you can do them on the floor.
Is that
yeah, you can stand.
okay? Great.
Yeah, do yours on the floor. If you don't have a wall that's accessible, try both. So again, kind of close to the crest of the pelvis, the glute medius. Generally, they're points called bladder 37, bladder 32, 52. Again, not really important information for you to know, but yeah, get into your glutes. Some of you may feel actually a lot of tension right in the middle of the glute. That's gallbladder 30, where the glute max is, so where the meaty part of your glute is. Maybe get into there. Either way, we're activating the entire channel in the lower body, in the gallbladder channel, in the bladder channel, and also promoting circulation into your hip joint. So do this rolling motion on both hips in your own time.
Oh, these are so tight.
Yeah, both are tight. Yeah, it's just how it is right now, just because most of us have been not moving enough for now 12 weeks. I'm a fitness instructor now. I'm not moving enough, and my glutes are tighter than usual. So I can understand how it's tricky for everybody else to find time and motivation to move. Do both. My left is my weak side and also the tight side. So maybe you can give a bit more attention and love to your tight side. And then we'll do one more body part. And you can do this anytime. So make sure you have some form of a firm ball you can use. So the feet. I don't know if you can see my feet. If you don't, that's okay. You can use your imagination. So literally, foot on the ball on the floor, and you roll out your feet. So you can lean in maybe with the toes down and wedge your heel from left to right on the ball. Now it's important to roll out the feet just because there are a lot of trigger points at the bottoms of the feet. My ball just rolled away. Come back to me, ball. Roll out the arches of the feet. So when we roll on the feet, we stimulate these trigger points, which help to release tension in the hamstrings, in the glutes. And it also helps to promote balance in our internal organs, maybe in other systems as well, lymphatic systems. So make sure to get toward the balls of the feet a little bit, roll out the arches of the feet. And also many of us experience plantar fasciitis, so the connective tissues at the bottoms of the feet get tight just because we wear shoes a lot and we don't move our feet enough. So the bottoms of the feet get tight, so rolling it. Try the other side, try both sides. Rolling the feet help to release that tension. Sometimes the plantar fascia can get so tight that it can now then refer tension toward the ankle or up the calf region. So we want to roll out the feet as well. All of the things we're doing is today safe for pregnancy, if you're wondering.
Thanks, Kaylee.
Okay. All right, that's both feet. Oh yeah, one last thing, but I think the next one would be nice if we set up our mat. Ashley already has hers set up. I still have to set mine up. So I'm gonna move my phone a little further back because I don't have to look at the PowerPoint anymore. I don't need to
We're
talk,
finished with
but,
PowerPoint? Okay, great.
yeah, you can, do you want to do the question thing or later?
Okay.
Later.
Okay, I'm gonna stop the screen share and then people can just see a bigger version of you then. Is that okay?
Oh yeah.
Okay, amazing. Great.
Okay. Give me a moment. Okay, while you're ready, so I'm gonna get you to stay seated. Your calves get tight, and we don't even think about how tight they get. But you can put a ball again on the calf, and then one leg at a time. Just go from side to side. This is a good one, especially if you get Charlie horses at nighttime, or you get cramping in the calf region. This is important. You can also roll the back of the knee. It feels funny. It really feels funny. It feels squishy, but effective nevertheless. Some of them effective things in life just feel weird. Remember the first time we drank coffee? That's weird. Burnt bean water, but it's effective. Same with rolling. Same with acupressure. You can do both sides. Okay, you folks keep doing the rolling while I set up my mat.
And if anyone else has a yoga mat, they can set them up now. If you don't have one, don't worry. You can just use whatever you've got.
Move this now.
I love your art, Queenly.
It's a hand-me-down from the family.
That's beautiful.
I definitely don't go and spend my money on art. It goes to food. So yeah, if you're wondering, on the floor, you can roll out your glute too. It's a lot more intense on the floor. Ashlyn was doing it before, but this is how you can get into the glutes. So remember, we're promoting circulation of body fluid and blood in one area, because anytime there's anything that's stagnant, we will start to feel discomfort, achy. And if we don't address it, it turns to pain or swelling, none of which we want in the body. So hence, pressure or acupuncture if further down the road you're interested. And then now yoga. So let's actually, let us sit on something. If you have a yoga block, or if you have a roller, you can sit on a roller. Or if you have a cushion, sit on a cushion. It's generally like sitting on a pedestal. So we're a little higher. So now we'll take a bit of stretching into the channels that we were working. Backs of the neck and sides of the neck. So you can tuck your chin in toward the chest, and then take your hands behind your head, interlace your fingers, and then hug your elbows closer toward each other. And then take some time to take deeper breath cycles here. Stay where you are with your neck stretch. I'm going to move my camera a little further back. All right. Ashlyn, you get, feel the muscles in between your shoulder blades broadening a little bit more or stretching wider apart. Or the shoulder blades stretching wider apart to help stretch out the muscles in between the shoulder blades. There I go. Keep your shoulders down. One more breath cycle here for the muscles on the back of the neck. Okay, let us bring the head back up. So I'm going to mirror you right now. Top of your head over to your right. Take your right hand to the left side of the head. Your left arm could either be out, fingers pointing down, and the arm straight, or you can bend the elbow and take the forearm and the hand behind you. Whatever stretches out the left side of the neck more, you may feel this in the upper traps and the upper shoulders. Pay attention to the posture. Are you able to press and root down through your legs and your hips to help you lift your rib cage a little higher. And then breathing. Constantly reminding ourselves to mindfully pay attention to our posture and our breath. And they work hand in hand. Good posture will help us breathe better. When we're rounded forward and all crunched up, I do this all the time, then there's really no space to breathe, and we end up breathing more shallowly, which is not great. Same thing on the other side, because that overworks the scalenes. Top of the head, over to the left, left hand to the right side of the head, relax your shoulders down, make sure you're elongating your spine, and either right hand out to the side, arm out to the side, or you can bend the elbow and take the hand and the forearm behind you. And breathe here. And already notice if there's any tension accumulating in the face and the jaw. We do it a lot. I do it a lot. I personally have an inclination to be intense and stressed out a lot of the time. So if you're anything like me, something in the body is clenching. So pay attention. And then pay attention to your breath. Just giving ourselves attention, because we so much of the time give our energy away. Let's come back to center. Okay, now we'll move a little bit more. So have your props ready if you have yoga props. I have a combo of a yoga block and a roller. They may come in handy. You can move your cushion out of the way. Let us do a forward fold, because we wanted to work on the back, the hamstrings, and the glutes. So first, we'll have feet apart. So for you who's pregnant, separate your thighs as wide as you'd like. Micro bend in the knees to start, and we'll actually just forward fold. Let the weight of the head come down, and then take your hands onto opposite elbows. And then from here, keep the micro bend in the knees and sway your spine gently from side to side. You'll feel your lower back muscles, the QLs, gently stretching out. Keep your lower abs pulled in to an intensity that works for you. Micro bend in the knees is okay, but really release the weight of the arms to let your shoulder joints extend. Release the weight of the head so that the back of the neck can release. And then from here, let us slowly release the hands, and we'll come all the way back up. Now remember this part of the body, the front of the shoulders. We're gonna get into that area. We'll get back actually into a forward fold, but we'll actually take our hands behind us. Interlace your fingers together. You can have your elbows slightly bent, but keep your feet apart, at least at hip width distance. Micro bend in the knees is okay. Hinging at the hips, and we fold forward again. Head and the chest down, and now elevate your arms away from the lower back. Now, if you feel it's appropriate for you to twist, I know with pregnancy, it's not great to deeply twist. So if you want to skip the twisting, skip it. But if it feels okay to twist, bend your left knee and extend your right leg a little straighter, and then twist your belly and the chest to the right. That should give the front of your shoulder, the anterior deltoids, a bit more of a stretch. So take the variation that works for you, always, with anything. Do what works for you and then let go of what doesn't. And then you can untwist if you twist it. Now bend the right knee quite a bit, straighten the left leg, and we'll twist belly and the chest to the left. Keep the head down. Gently elevating arms away from the lower back. So now the anterior deltoids on the left side stretch out. You can keep twisting to the left if it feels appropriate. We'll take another deep breath in. Exhale here, and then we'll untwist. Release your hands down. Okay, now we'll go into a lunge to get into the front of the hips. So go toward the front edge of your mat. You can transition with props. If not, right foot steps back, and then you can lower your right knee down. You can face any way. I can go this way too. Okay. If you want to pad anything underneath the right knee, you can. So with props, you can have your hands on each prop. If you don't have a prop, both hands on the left thigh. Firming your glutes, drawing your lower belly in, and lift the rib cage up. So do what you can to peel upper body away from the left thigh so that the front of the right hip more fully stretches out. And then we'll take a bit of a side bend. So without a prop, you can gently rest your left forearm on the thigh and we'll side bend over to the left, letting the side of the body on the right stretch out. If you have a prop, take your prop out to the side in line with your pelvis, your left hand down, side bend over to the left. So we're stretching out the right side of the body. Now pay attention to your breathing again, just because this does change how you breathe. We're somewhat collapsing the left side of the lungs and expanding the ribcage on the right. One more deep breath in here. Exhale here. Let's come on back to center. Okay, for the hamstrings, keep your right knee and the left foot where it is, but we'll just shift the hips back. So left leg is straight, flexing the left toes up. If you do not have props, hinge at the hips, keeping your back relatively flat. Hands could be on the thighs, with the lower belly in. You can have hands on your shin. If you have props, by all means use them. If you're close to a chair or a couch, you can lean your hands on your furniture. Furniture is great. You can definitely move and stretch with furniture around. So keep elongating the spine and then use your upper back muscles to help you pull the shoulders back. Rather than do this, we want to elongate and widen across your collarbones and your chest. Let's take one more deep breath in here. Exhale here. We're going to switch sides. Okay, let's bend your left knee, and then we'll step the right foot forward. So we'll do the same thing on the other side. We'll step the left foot back. We'll lower the knee down. Both knees are bent, so you can pad something underneath the left knee, fold a towel or a foam pad, and then now, without props, hands on your right thigh. With props, hands on props. Relax your shoulder blades down. Kind of let them drip down away from the ears. Elongate the spine. So your glutes are working, lower abs working, the side body working. Think about making space for baby, lifting rib cage away from pelvis. For those of you who are pregnant, keep breathing. Letting the front of the left hip, the hip flexors, fully extend by peeling upper body away from the right thigh, and then let them stretch out as we stay here. Remembering to anytime you are actually stretching out, hold your stretches for around 30 seconds. Anything less wouldn't be very effective at all. This is just for stretching. If you're moving just for mobility, that's a different question. You can move and not hold poses as much. So now side bend without a prop. Right forearm on the right thigh, keep the shoulders down. Left arm up, side bend over to the right. This is variation one. If you have a prop, take your hand onto your prop in line with your pelvis, your right hip, and then we're still side bending over to the right, letting the left side of the body stretch out. You'll probably feel this from the hip flexors actually, all the way up toward your armpit. Pay attention to your shoulders. If they've shrugged up, let them glide down into the back. And then let's come back to center. Hamstrings on the other side. Shift your hips back. Pelvis, stacking on top of your left thigh and the knee, and then flex your right toes up. Right leg should be straight because we're going for hamstrings on the right side. If you don't have props, hinge at the hips. Take your hands onto your thigh. You can always take your right foot a bit more lateral to give your belly some space. Hands on the shin, or if you have props, use it. Now feel your spine to full extension. Use your core muscles to help you extend the spine. Often when we think about core muscles, we just immediately think abs, but it's everything around your entire torso from shoulders to your hips. So utilize your full set of core muscles to extend the rib cage away from the pelvis. Make space for breathing, make space for digestion. We'll take one more deep breath cycle here. Okay. From here, we won't step ourselves forward. We'll actually somehow find hands and knees position. You can keep facing the way you're facing. Move any props out of the way for now. So we're going to go back to a downward dog, and then we'll do something called the squats in downward dog. So tuck your toes under, have your palms at shoulder width distance, push your hips back and up. Your legs can be bent in the knees. Your number one priority is to have straight arms and a straight spine. So your feet could be wider if you want more space for belly again. And then keep stretching your hips back and up, your tail, your heels back and down. The tailbone is stretching back and up. Stabilize your palms and just bend your right knee. We're walking out the legs. Keep the feet the same, in the same spot, but stretch out the left leg. Let the calves stretch out. Let the hamstrings on the left side stretch out again. Same thing on the other side. Bend the left knee. Extend the right leg towards straight. Let the calves and the hamstrings stretch out on the right side. Okay, now come back, even weight in both feet, and then we'll actually pivot, heels and toes out. So both legs are in external rotation. Keep the heels lifted, and then we will squat down with the legs. And keep the arms straight, and then we'll come back up toward a downward dog shape. Let's inhale to squat. Firm your glutes, gently lift the pelvic floor, and come back up to downward dog. Inhale, squat down, press down through your fingers, keep your arms straight. Exhale, firm your glutes, lift the hips up. And we'll do that 5 more times. Inhale down, exhale up. 4 more. Inhale, squat and downward dog arms. Exhale up. Inhale, come down. Let your inner thighs gently stretch out. Firm your glutes, exhale up. 2 more. Inhale, squat. Exhale up. 1 more. Okay. You can come back to parallel legs. So all 10 toes pointing forward. And then bend your knees a little. Start to walk your hands back toward your feet. Again, your feet could be as wide apart as you'd want them to be. And then 1 more time, we're in a forward folding position. This time, step your feet a little wider apart. Let's hook your hands behind the calf or the ankles. Micro bend in the knees to start. Gently scoop the lower belly in. And then using the strength of your arms, pull yourself, your upper body a little closer toward your inner thighs. Remember, your legs do not need to be straight. Press into your feet. Scoop the lower belly in. And your arms help you hinge at the hips to kind of fold in half like a book. Let the hips stretch up, tailbone up, and you can do that with micro bend in the knees. And we'll do 1 more deep breath cycle here. Okay, now bend your knees again. We're going back to downward dog 1 more time. We're going to do glute stretch, pigeon, and then we'll finish up. So walk your hands back forward toward a downward dog. Now take your time. We're taking the left knee forward first, behind the left wrist from downward dog. Take the knee down, the shin down, the foot down. At this point, you can pad something underneath the left hip, right leg extending straight back behind you. Flex your ankle and the foot. You can come down a little closer toward your forearms. Some of you can get quite close toward the floor. You can stack your palms and place your forehead down on your hands. Breathe here, stay where you are. Make sure that your left thigh is slightly externally rotated over to the left, meaning the knee joint opens out to the left a little further away from the hip joint. Keeping your left foot and the ankle active, and pay attention to how you're breathing again. Are you inhaling to expand the diaphragm and gently pushing the diaphragm downward toward your stomach, toward your liver? And then as you exhale, you can let your diaphragm relax and lift up again toward the base of the lungs. Repeat the motion. Notice how your breathing feels in this particular stretch. And we'll do 1 more deep breath cycle here. And then let's do hands and knees this time. Find yourself in hands and knees position. Your knees could be about 1 or 2 inches apart, and just sweep your hips from side to side. This also could be a gentle and nice hip stretch for any of you with tight hips. Probably all of us. And then when you're ready, we'll do the right side now. You can take your right knee forward with your, well, no, right knee forward behind the right wrist, left leg extending straight back. Firm your right ankle, firm your right foot. You can stay up or you can come down lower toward the mat. Depending on what your right hip will let you do, don't do anything that hurts the knee joint. Good. And then pay attention to your breathing again. Being mindful is a big tool to help us understand what is relaxation for the body, because it's different for everybody. And our awareness of how we feel physically and mentally will help us decide and understand whether we are stressed out, whether we are always holding tension, or if we actually also have ability to relax ourselves. Everything we've done today are all tools to help us release tension, to help us find relaxation. Pay attention to your breathing again. How does this current inhale feel? And how does the exhale feel? Are you utilizing your diaphragm to help you breathe? And then let's carefully come on up. So let's lean your weight over to the right. We'll take the left leg forward. I'm going to face you again. And I'd say you can take your pedestal back, be it your yoga block or your cushion. And we'll just, a quick sit. Sit however you're comfortable. It could be cross-legged, but if you'd rather have legs straight, you can even put a roller underneath your thighs. This is pretty comfortable. I'll show you the side view of what this looks like. So still lift the rib cage away from the hips. You can have your hands down on your legs. And then at this point, just take 5 of the deepest breath cycles you've taken all day. You can do this with eyes open or closed. Utilize your diaphragm, especially with the inhales. Take full exhales. Deepest breath cycles you've taken all day. Because the function of our breathing helps to promote smooth flow of circulation throughout the entire body. So this is important. Breathing a little slowly. Knowing too, also when we slow down our breath cycles, we help to slow down overthinking in our mind. We all do it. Let us close practice. We'll take our palms toward our center. It could be palms on your chest, or it could be namaste position. Giving yourself a moment of gratitude for everything that your mind, your body, your heart allows you to do. Also your soul. That's a completely different webinar. What's the soul? Thank you very much, everyone.
Namaste. Thank you so much, Queenie. That's amazing. I feel so relaxed. That's awesome. I'm just going to go back to our presentation just for a hot minute. Awesome. So I hope that everyone enjoyed the yoga. And if you're watching this later, not live, I hope that you enjoyed as well too. Please let us know if you have any questions. So again, I mentioned the bonuses. I think there might be somebody that wasn't here at the beginning. So I'm gonna send out an email this evening. There'll be an invite to join our private Flourish Females Facebook group, which is a way to stay connected, to ask questions to any of the women's health experts at Flourish. We're gonna post all of our webinars there and lots of cool content. I'm gonna send out a recording of this webinar, so if you want reminders about some of the acupressure points or you wanna try to do yoga again, you can go for it. I'm also going to send out a link if you want to book a free discovery call with Queenly to talk about acupuncture or yoga or anything like that. And we're now, I think, yeah, Queenly. Okay, so how this is going to work is I'm going to watch the chat and Queenly is going to ask her question, and whoever answers first in the chat will win a virtual one-on-one yoga session with Queenly. And so let me just exit this for 1 minute. We'll let my hand see. Okay, great. Amazing. All right, Queenly, you go for it.
There could be like more than one answer. Either the name of the point or the location of the point. Which point is used to help calm the mind and to help with nausea?
Can anyone remember? Okay,
Yes.
what do you mean by front? Do you mean like this side or this side? You can unmute yourself as well too if that's easier.
Like the inner side, the one that faces you.
Okay, amazing. And is your name pronounced Sahar? Is that how it's
Yeah.
Okay, amazing. All right, congratulations, Sahar. I can get your email from the webinar, and then I'll email you to connect.
Sounds great.
Amazing. Okay, great. Give me 1 second here. Okay, does anyone have any questions? If you have any questions about acupuncture or, sorry, my husband is moving things in the kitchen right now, but any questions about acupuncture or yoga or whatever, feel free to let us know. And we are so happy again to see you guys tonight. Thank you so much, Queenly. That was amazing. So relaxed, by far the most relaxed I felt this week so far. So thank you so much.
It's only been 3 days, but okay, I'll take the credit.
Yes, it's all you. All right, guys, have a great night. I hope everyone sleeps well after that, and I hope to see you all soon.
Thank you.
Bye. Thank you.
Bye.
Bye.